Advancing wellness through salivary diagnostics. We've got a vast test menu, from periodontal pathogens to genetic susceptibility to caries bacteria to HPV detection and candida, all from one simple 30-second swish and gargle. The patient will take 5 milliliters of sterile saline, swish and gargle, spit it into the collection tube, and then a preservative is added. That preservative brings reliability and stability for 21 days. To complete the order, you are going to log into the account. Place the order. This is also where you will retrieve the results. This was an in-office collection. We do offer a way for you to ship a kit to the patient's home, maybe before the patient's actual appointment. Logging into the account, clicking Ship at Home button, the patient then receives a collection kit where they will collect it home, put it in the mail themselves. We receive it for processing, and you get the test results to share with your patient. We are always here for expert clinical support. I am Diane Larson, Director of Clinical Education, but we do have an advisory board of experts that we can go to. And please don't forget our client success team. They are always here to help you as well. And we need your help to help solve the puzzle. Periodontal disease is very complicated, and the more you know about their periodontal disease, there could be overall systemic ramifications. So 2 pieces to the puzzle is a test that we call Alert 2. It is our only combination test, combining the MyPerioID, which is a genetic risk assessment, so a one-time only test, really looking at the patient's inflammatory response, and the MyPerioPath. The MyPerioPath, if you are an oral healthcare provider, is going to help you confirm the cause, create a personalized treatment plan, and a way to check what you were able to achieve in your therapy. If you are a medical provider, this test may help confirm that there is an oral reason why this patient isn't responding to your therapy. Other avenues to explore with this test would be surgical clearance, whether it's knee or hip replacement in the medical space or an implant in the dental space. And then this MyPerioPath allows you to connect the dots, the mouth-body connection, those oral systemic links that we are all here learning about. They can complicate and in some cases cause, so we believe in testing, don't guess. The post-test, typically 6 to 12 weeks. You will expect to see a reduction, but not always. If there isn't a reduction, then you might want to consider adding on a test, and you do have that capability within that 21-day viability with that addition of the preservative. If the pre and the post MyPerioPath are linked correctly within a calendar year, then a $20 discount is then applied. The OralRisk caries, looking at bacteria, but looking at the risk for decay. Does this patient have dry mouth? Are they on several medications? This could put them at risk for decay. So knowing their dysbiosis is going to allow you to help reduce that risk. OralRisk HPV. HPV is now the leading cause for oral cancer. We look for 51 different types, and your goal as their healthcare provider is to establish if it is a persistent infection. So consecutive positives within a 12-month time will establish a persistent infection, which would then lead to more frequent oral cancer exams. Celsus 1 is our more comprehensive genetic test, really expanding off of the MyPerioID portion of the Alert 2 and looking at inflammatory genotypes. And how can this patient reduce their overall inflammation? Really opening up the conversation for overall health. Just a quick review, our bacterial testing options include the Alert 2, MyPerioPath, and OraRisk Carries. Our genetic test options, MyPerioID, which is part of the Alert 2, and the Celsus 1 are more comprehensive genetic tests. And then viral or other organisms that are available: HPV, Candida, herpes simplex virus, and chlamydia gonorrhea. We are here to help you. We want you to become comfortable and confident with salivary testing. So we offer a weekly blog called Trends in Salivary Testing. Also on our main webpage, we have case studies where you can learn from and read through the practical experience of what some clinicians have known as success with that patient. Join OralDNA Labs